Hi, y'all. This is Nina, and you're watching Southern Digest. This is part 7 in the series FDA Advisory Committee Meeting Testimonies. This speaker is a faculty member at the University of Maryland School of Pharmacy. He has some very interesting slides with the sources in footnotes at the bottom. So don't hesitate to pause the video and give closer inspection. Now, if you want to see the entire 8 hours of the meeting, that link is below, along with timestamps for this particular testimony. And as always, be of good courage. We are not alone.
Hi, I'm Peter Doshi, and thanks for the opportunity to speak. So hopefully you can see my title slide with my financial disclosure. For identification purposes, I'm on the faculty of the University of Maryland and an editor at the BMJ. I have no relevant conflicts of interest. Next slide, please, which is labeled Slide A. I want to start off by asking a question. Just what problem is this third dose aiming to solve? If we have a pandemic of the unvaccinated, as our public health officials have repeatedly stated, why would a, quote, fully vaccinated person need a third dose? Next slide B, please. The briefing document suggests the rationale for boosters is waning immunity, but the lowest vaccine efficacy figure mentioned is 83.7%. And last month, FDA approved Pfizer's vaccine, stating that efficacy against symptomatic COVID is 91%. Sure, a third dose might nudge up efficacy numbers, but so too might a fourth dose and a fifth dose. The thing is, the two-dose regimen efficacy numbers are already way higher than the 50% bar that FDA set in June last year for an approvable vaccine. Before contemplating the licensure of dose 3, shouldn't FDA first require evidence that the two-dose regimen no longer meets the efficacy bar the agency just weeks ago said it met? If vaccine efficacy is now below 50%, let's see the data. Next slide C, please. Let's discuss safety. When discussions about a third dose began in July, CDC Deputy Director Dr. Jay Butler said it was vital to find out if the third dose increased adverse reactions, particularly severe ones. Unfortunately, we're still in the dark. Pfizer's booster application reports on just 329 people with no control data. Now, there is a Pfizer ongoing placebo-controlled randomized trial of boosters in 10,000 people not discussed in the briefing document. But this trial is unlikely to satisfactorily characterize booster safety. First, the trial is too small and the enrollment's limited to healthy participants. Second, we really need to know how safe boosters are in people who already had bad reactions to dose 1 or 2. But such people are obviously less likely to volunteer to participate in this trial, so we won't have the data to answer the question. Yet if the booster is approved, such people will surely be mandated to receive a third dose. Final slide D, please. I'll end with a question. Last week, 3 medical licensing boards said that they could revoke doctors' medical licenses for providing COVID vaccine misinformation. I'm worried about the chilling effect here. There are clearly many remaining unknowns, and science is all about probing unknowns. But in the present supercharged climate, and I'll point out that multiple members of this committee are certified by these boards, I want to ask FDA, what is FDA doing to ensure that those advising it are able to speak freely without fear of reprisal? Thank you for your attention.